People think very, very long and hard about going and finding the right cardiologist or finding the right neurologist or indeed finding the right surgeon. They don't think enough, I would argue, about finding the right radiologist and finding the right imaging center. When patients come to HSS, they can expect the highest level of imaging expertise and care. Kindness, efficiency, but also accuracy in terms of their diagnosis. So there is no routine MR of the knee here. There is no routine ultrasound. We do things very carefully, fine-tuned for that individual patient.
We have 5 ultrasound suites, all dedicated to musculoskeletal imaging. So just by the sheer volume of what we do and the breadth of what we do, I think that we're on the forefront. I mean, we do things that other people don't do in the United States.
Not many institutions around the country perform musculoskeletal ultrasound. And even within musculoskeletal ultrasound, we do a lot of specialized imaging as it pertains to nerves, muscle quality, tendon injuries. So our work here is pretty unique.
Patients who choose to be imaged at special surgery benefit from innovation. When you look at a radio frequency pulse, they have side loops. And the innovation lies in our collaboration from our research lab and our clinician scientists with physicists and engineers at General Electric Healthcare. It's truly state-of-the-art imaging that's not available anywhere else.
Some of the things that these machines are now capable of that we couldn't do maybe 5-6 years ago easily are things like 3D imaging, where you can actually get a 3-dimensional image and you can rotate that image and look at it in different planes. Some of the bells and whistles include some really cool things, like something called elastography, which is a method where you can actually look at the compliance of a tissue. We see a lot of runners here at HSS, a lot of heel pain because of Achilles degeneration. And so if we can tell the clinicians that, hey, we found a number beyond which we know that your patient is at risk for rupturing, then that helps the clinicians tailor their treatment to the patient. And it may also be a wake-up call for the patient not to continue the offending activity.
When patients come to the hospital, they know that they are getting the best MRI images possible.
So I'm going to start pushing you in, okay? Okay.
In the past, images that were created were read by the radiologist. But now we're moving more into the quantitative aspect where we can actually measure things within your body using MRI in the hope to not only treat patients as they come to the hospital, but also to predict how their implant, how their cartilage will function in the future.
MRI provides an additional tool in the management of someone with peripheral nerve problems by being able to identify the precise site of the injury, the extent of injury, and also evaluate the surrounding soft tissue structures. So with MRI, we're not only able to directly visualize the nerve and the surrounding structures, but also assess the muscle.
EOS is an X-ray modality, but it's an ultra-low dose way of getting an extended field of view of a body part. In the old days, before we had EOS, if you wanted to look at scoliosis, so something more than just a 17-inch film, it would be a very big exposure for the patient. The beautiful thing about EOS is it can take those extended pictures from basically skull all the way down to ankle with no distortion and with a very low dose. You now feel more comfortable scanning children who, because of scoliosis or other deformities, may need to get multiple x-rays, but you really don't want to expose them to radiation. So EOS gives us that freedom to have a very low dose where we feel comfortable saying, okay, we can scan this patient now.
The innovations that patients can expect in the future are faster scans, better image quality, the ability to see soft tissues around total joint replacements even better, and a better understanding of the biochemical composition of tissues within the human body.
We want to be able to predict not just what you can do today, but what you're going to be able to do in 5, 10, 15 years. Where you go for imaging really matters. It will drive your management in a very effective way. You'll get an accurate diagnosis and you will have a better outcome.